you can come closer and basically you can close the, yes, switch off if it's maybe it's better. All of them you can switch off. Okay. So basically you know that the ionic fluoride is the most effective anti-caries agent. Fluoride is essential for the reproduction, the growth, heart tissue mineralization. So basically it's an important element, the fluoride. Where we can find the fluoride in the water, food, air, toothpaste, mouth rinses, gels, and also there are possible fluoride tablets. I will talk about it the second, so the seminar. Basically the low caries incidence at around 1 ppm, which means milligram per liter, so 1 milligram per liter. ppm, that means parts per million. Okay, it's useful to know because Dr. Barnansky always on the exam. Or more fluoride in the water, in normal climate, it provides the low caries incidence. In cold climate, less fluoride is enough for the caries protective effect, so 0.7 and 1.2 ppm fluoride is necessary in tropic climate, so in hot climate. So basically, averagely 1 ppm is enough to stop the caries. It have to be caries protective. If we have 1 ppm in the water, basically that the normal drinking water, if we find 1 ppm, it's good because it's protective, caries protective. Discovery of effect. How they discovered that the fluoride is good for us. Basically, McKay in the USA find that in Colorado Springs, the patient has, basically everybody has a little bit discolored teeth. There were spots on the teeth, but nobody has caries. Low incidence of the caries. And he find out that in the local water, there is a high concentration of fluoride, more than 2 ppm, because near of the town, near the Colorado Springs, was a lot of mine. And from the mine, it's coming out the fluoride, basically, from the minerals. And it's provided that region has not exactly high caries rate. And that was the finding, but it was too much fluoride, basically, because too much fluoride is also not good because it will cause a fluorosis. That means the teeth will be discolored and the aesthetic is not good. It's strong but not aesthetical. Yes, the effects in enamel at first is a chalky white, then progress to brown spots. This is the fluorosis. And GB black associated the mottling and low caries incidence with the high fluoride in the water, and suggest 1 ppm fluoride in the water supply. So you can see the larger the fluoride concentration, the mottling index is higher. That's why we have to take care about the fluoride. Small fluoride is okay, but too much fluoride is toxic and it's also disturb the development of the teeth. Distribution of the fluoride, foodstuff, drinking fluid, ultimate source, fluoride containing minerals in association with calcium and aluminium. Most fluoride salts are insoluble. Dried foods contain higher concentration of fluoride. Cooked foods, similar concentration have than before cooking. It's not true for the C vitamin, you know, because after cooking the C vitamin is less concentration. Animal tissue has low level of fluoride, so we have to eat from vegetable. That's why. It's interesting that, for example, in the tea, basically we have high fluoride concentration. So if we drink tea, it's good. It's useful because it contains a lot of fluoride and it's help to build in the enamel. And also in the apple, orange has some vegetable. Cornflakes has also high concentration. How we can intake the fluoride? From food, toothpaste, and tablets and mouth rinses. Fluoride is precipitated by excess calcium. Increased calcium intake reduces the absorption of the fluoride. So it's very important if you would like to use the fluoride, not to drink it with dairy products because it contains a lot of calcium, and the calcium inhibits the uptaking of the fluoride. Okay, it's important information. Calcium, magnesium, and aluminium reduce the absorption. So if you cook it in an aluminium dish, for example, the foods, less fluoride concentration can have because of the aluminium. natrium fluoride has a good solubility. Natrium monofluorophosphate form is defined the fluoride from the calcium, but the fluoride remover from this need enzyme or acidic pH. So the natrium fluoride is the best. The most toothpaste you can find natrium fluoride. Some of them contains natrium monofluorophosphate. Yes, the estimated fluoride intakes in milligram in the UK. You can see low fluoride area and high fluoride area is what is the concentration it is necessary to uptake. Absorption. If we eat some kind of fluoride containing food during the oral cavity, it's the foodstuff, through the oral mucosa, 5 between 8% absorbed by the mucosa. But main part of it in the stomach and the small intestine, and you can intake with inhalation and through the skin, for example. But it's not so large part of the total. Fluoride is not lipid soluble. Hydrogen fluoride is this can diffuse across the gastric mucosa. In the intestine might be an active transport mechanism. Larger intestine, possible some fluoride separation. Fecal fluoride includes separated and unabsorbed fluoride too. Absorption, lipid soluble substance can be absorbed down concentration gradients. Maybe some channels for anion diffusion would allow the fluoride diffusion. How in the blood plasma level? After absorption, the fluor passes into the portal circulation, reach the liver basically. So if we eat some fluoride content food, the plasma after the eating, the concentration rises between 30 and 60 minutes, then this line over 3 hours. Tissues, in the adipose tissue, low concentration, cerebrospinal fluid, low concentration, kidney concentration, gradient from cortex to papilla, calcified tissue, accumulated the most fluoride. So basically the most fluoride, 99% of the fluoride can be found in the heart tissue, the calcified tissue, in the bones and also in the teeth you can find. In the body secretion, sweat, bile and saliva, and also in the milk we can find it. So we secrete it with different kind of fluids, different kind of, yes. Milk basically contains the 50% of plasma levels. It's basically important in case of the women's until they have baby, you know. Because in the milk, 50% of the plasma level you can find the fluoride. Saliva contains 7% of the plasma level. So less concentration in the saliva, but it's at around the same. A little bit lower because it's 70%. Also the sulcular fluid slightly higher than the plasma levels. Sulcular, the gingival sulcus around the teeth you can find. Fluoride can enter the enamel from food and rings from saliva and from the blood. How will intake, how will build in the fluoride from the blood? Basically through the pulp. In this case, in the dentin also can build in some fluoride. And the outside surface because of the fluoride content foods. So the mouth rinses, toothpaste contains a lot of fluoride and can build in the enamel, in the oral cavity. This is the metabolism of the fluoride. You can see the plasma blood level, and also it will go into the kidney and will excrete it with the urine, built in the bone, and also into the teeth, not just into the bone. Concentration of the fluoride in the plasma and in the saliva. You can see that the same if we eat something which contains fluoride, the plasma blood level, fluoride concentration will rises, will be increased, and also it will follow the saliva concentration. But it's less concentration because 70% of the blood level concentration, but it's the same. You see the level after we eat some fluoride content. So we can see the plasma fluoride concentration the first, if we eat without any kind of other food, so it's higher rate. If we eat it with milk, it will be less, so it's a little bit inhibit the absorption of the fluoride. If calcium-rich food we eat, even more less will be the blood fluoride concentration, so inhibit absolutely the calcium. This is the dairy product, and the second is calcium-rich food. So that's why you have to know if you would like to build in the fluoride, not to eat with dairy products and calcium-rich.
Calcium is in
Yes, of course. This is the problem. During the growth calcification, fluoride incorporated into the new apatite crystals. Fluoride is taken up at the bone surface by ion exchange. The calcified tissue contains 99% of body fluoride. Rapid absorption, no time to ionic exchange. Slow deposition, more fluoride can be taken up. In case of the bone, it's important. Bulk of the dentin and cementum are formed as a steady rate during the initial development of the tooth. Fairly uniform fluoride concentration. It's built in because of the pulp has a circulation and provide the fluoride for the dentin and the cementum. It's a little bit different than the enamel, but also the fluoride concentration is basically the same in the case of the dentin and the cementum, and it's quite stable, the concentration. Enamel, relative constant concentration through its thickness, great variation at its surface. Younger has higher concentration, so younger, when it's a little bit maturated, the enamel, you know. After eruption, the concentration of the fluoride in the enamel is higher. Elders low because of the attrition, erosion, and abrasion, because they lose the enamel basically. That's why less concentration. Bone concentration increase throughout the life, so it's always increase. You can see these are the bones, the cross section of the bone, and the highest concentration of the surface of the bone, and inside less, and in middle also high concentration. And also if you see, for example, the dentin, at around
the middle is the least.
Yes, the middle is the least, basically, yes. Because from the pulp can get a lot of fluoride. From the surface can get a lot of fluoride. Just middle do not get fluoride because it's just constant concentration, because no supply during the life. Also you can see the same if we see the enamel. The highest concentration in the surface, in the middle not so large concentration, and the dentin enamel junction also higher concentration. So the main thing that the two border is the highest concentration in case of the bones and in case of the enamel, dentin, and so on. Okay, you have to sign just this. Yes, it's visible here at the surface. It's higher, and after low concentration at the dentin enamel border, it's a little bit higher. And towards the pulp, if we are going in the dentin, at the pulp is the highest concentration because there is circulation and it's supply and provide a lot of fluoride. Also the same in the cementum, case of the cementum and in case of the dentin, so it's understandable. Yes, this is the remineralization. Before the remineralization and after the remineralization, you can see basically the fluoride concentration. If you have, for example, an incipient caries, you remineralize it, it will be higher the final concentration of the fluoride before it was. Okay, because more can be built in the demineralized enamel, and basically after remineralization, so after you give the patient Elmex jelly, Elmex gel, you cover the tooth surface with high concentration fluoride, more can be built in demineralized enamel. Okay. So finally, it's better, and it's better because a lot of hydroxide group will change for fluoride group, and more hydroxyl apatite crystal will be, which is better because less soluble for the acidic environment, so more resistant for the acidic environment. Dental plaque accumulate fluoride from saliva, a circular fluid good in acidic pH for the remineralization. Excretion of the fluoride, finally excreted by the kidneys, amount of the fluoride is reabsorbed, but it depends on the acidity of the tubular fluid. High acidity is good for the reabsorption. The non-reabsorbed fluoride is excreted in the urine. Fluoride and dental caries. The fluoride can act 3 levels, basically the soft tissue, to modify the developing of the teeth. So when we give fluoride in childhood, the morphology will be different. No
You already
sodium,
said that.
yes. No sodium fissure system, no so high cusp, basically less retentive surface. It's better, yeah. To affect the mineralization, demineralization, so if the fluoride built in, the fluorapatite will be more resistant, so that's why it's good. So this is the hard tissue, and also can have an effect for the bacteria. Basically inhibit their metabolism, which is very important. We will see. So I talk about wider, shallower fissure, less susceptible to the dental caries. But the main reduction of the caries lesion has been on the smooth surfaces. So not because of the morphology, because of the structure of the enamel, won't be caries. So the main effect is in the mineralization. During the mineralization, fluorapatite, rather than hydroxylapatite, is formed. Larger crystal size, more resistant to acidic dissolution. So that's why in childhood it's useful to give fluoride for the children, but not so much. We will talk about, because if we overdose it, it will be basically fluorosis. After eruption, the fluoride uptake continues on the enamel surface. After acidic pH remineralize the surface. Yes, and this is the solubility. The fluorapatite has a less solubility than other kind of minerals in the enamel, because it can be calcium fluoride, brushite, and octocalcium phosphate. So the best is the fluorapatite. Because in case of some patient who has some syndrome, amelogenesis imperfecta, and also Turner syndrome, they have not exactly apatite, rather this kind of calcium fluoride, brushite, and octocalcium phosphate. So other kind of crystals are developing which are not good. Better the hydroxylapatite, but the best is the fluorapatite, because this is the more resistant, the most resistant. Modifying the plaque metabolism. So the fluoride has an effect, and local effect in the plaque, basically altering the ability of the organism to produce acid. So inhibit a little bit the acid production of the bacteria. Produce significant inhibition of glycolysis, inhibits the glucose transport, cannot fermentate the carbohydrates. Inhibits the membrane ATPase, and inhibit acid production and the general energy metabolism of the cells. So a little bit inhibit the bacteria, the streptococcuses basically. So that's why very good. But it has toxic effect. This is the first one, is the enamel. Okay, ask me.
In the previous slide, you said inhibition of the ATPase, membrane ATPase. How it could be helped?
I don't know, because it's a biochemistry, some kind of biochemistry procedure. I don't know how it's working, but somehow this ATPase so inhibit this enzyme, I think. If it's binding to the enzyme, absolutely cannot work. It has a toxic effect for this enzyme, I think this way. Cannot make ATP, and the energy metabolism of the cell is not working anymore, and maybe kill the cell. And no reproduction of the cell after it, so it's better. That's why the fluoride is useful. The first manifestation is the enamel fluorosis, when you overdosing the fluoride, so that you can see that the children has stained and discolored teeth. This is the first manifestation of the fluorosis. And later, and also if we give too much fluoride in the developmental period, basically, of the primary and secondary teeth, so the permanent teeth. After that, we can intake more fluoride. It won't cause fluorosis, just in the developmental area. From basically 3 years old to until the wisdom is developing, so 18s, for example. The porosity may be extended through the full thickness, reduce the strength, and because of the fluoride inhibits some protein synthesis in case of the dentinogenesis and in case of the amelogenesis. So it's a little bit disturbed amelogenesis. That's why we have been other kind of enamel, which is strong basically, but it's not so aesthetic. Which is very important, and Dr. Barn always asks the lethal dose of the fluoride. Not because of toothpaste will happen, I think, and mouth rinses. Can happen because if the children take a lot of tablets. So very carefully we have to take care about these fluoride tablets, okay? Not to give to the children, we have to dose it if we give it in childhood. So 50 milligram per kilogram, this is the lethal dose in case of adult. But it can be a problem when between 6-year-old children who is 20 kilogram eat, for example, but it's impossible basically, it's too much, but can be dangerous, okay? What can be the symptoms of the toxicity of the fluoride? Basically nausea, epigastric pain, vomiting, limb spasms, tetany, convulsion may develop with pitosis. The blood pressure, pulse rate fall, respiration depressed, and unconsciousness follow. So it can be very serious, but it's rather different kind of fluoride content minerals. Not exactly the toothpaste will be toxic, but we have to know the lethal dose. Treatment is urgent. Induction of vomiting, administration of 1% calcium gluconate because it's inhibit the absorption. So calcium gluconate we give the patient. Milk may be used if these are not available. Hospital treatment should be necessary. Maintenance of the airway, gastric lavage with calcium solution, and intravenous administration of glucose is necessary. Calcium salts and sodium bicarbonate also we have to give the patient to inhibit the absorption, more fluoride. It may be necessary to provide artificial respiration and cardiac stimulation if it's necessary, if it's very, very serious, the problem. So that's it I would like to talk about. And we will talk about the fluoride.